In the human skeletal system, there are many bones. There is the frontal lobe, the maxilla, the mandible, the sternum, costal cartilage, true ribs, lumbar, clavicle, scapula, humerus, radius, carpals, ulna, metacarpals, phalanges, ilium, the iliac crest, the sacrum, femur, the patella, fibula, and tibula, the talus and the calcaneus, the metatarsals, and the tarsals, and many more.
The three chest muscles we have are the teres major, internal intercostalis, and the pectoralis minor. The teres major's origin is the lateral border of the auxiliary scapula. Its insertion is the deltoid tuberosity, and its action is adduction of the shoulder, helps in extension, and a slight lateral rotation of the arm. The internal intercostalis's origin is the inferior margin of the ribs 1 through 11. Its insertion is the superior margin of the ribs 2 through 12, and its action is depresses the ribs cage during expiration. The pectoralis minor's origin is ribs 3, 4, and 5. Its insertion is the coracoid process of the scapula, and its action is abduction scapula and rotates it downward. It elevates the ribs during forced inhalation.
Drew the skeletal system. First we started with the skull and drew all the muscles in the skull. Next we drew the chest or pectorals. Within the chest we drew the internal intercostalis, the pectoralis minor, and the teres major. The internal intercostalis origin is the inferior margin of ribs 1 through 11, superior margin of ribs 2 through 12, and it depresses the rib cage during expiration. The pectoralis minor's origin is the 3rd to 5th ribs near their costal cartilage. It inserts at the medial border and superior surface of the coracoid process of the scapula. And its action, it stabilizes the scapula and depresses the scapula and elevates ribs 3 through 5. And the teres major's origin is the axillary border of scapula. It inserts at the deltoid tuberosity, and its action is it adducts, extends, and lateral rotation of the arm. Next, we drew the abdomen. The muscles we drew in the abdomen were the rectus abdominis, the diaphragm, and the internal oblique. The rectus abdominis' origin is the pubic crest. It attaches to the cartilage part of ribs 5 through 7, and its action is that it flexes the lumbar and compresses the abdomen. The diaphragm's origin is the lumbar vertebrae and ribs 10 through 12. It inserts at the central tendon, and its action is inspiration. And the internal oblique's origin is the iliac crest. It inserts in the last 4 ribs, and it contracts or compresses the abdomen. After that, we drew the quadriceps. Within the quadriceps, we drew the pectineus, adductor longus, iliacus, and the sartorius. The pectineus' origin is the pubis. It inserts at the proximal posterior femur, and its action is that it adducts laterally and rotates the thigh. The adductor longus' origin is the pubis. It inserts at the middle line aspera femur, and its action is adduction. The iliacus' origin is the iliac fossa. It inserts at the lesser trochanter, and its action is that it flexes the thigh. And the sartorius' origin is the anterior superior iliac crest. It inserts at the medial side of the tibial tuberosity, and it flexes the thigh and knee and rotates laterally. Then we drew the gluteus maximus, which is its origin is the surface of the ilium. It inserts at the lateral condyle of the tibia, and its action is that it adducts the hip and laterally rotates the thigh.